what we've been working on is trying to identify a tool to measure inflammation in brain tumors, and really more broadly figuring out a way of using this tool to explore tumor biology in response to therapies that we give patients. As we advance in our therapies, there are different biological processes and different ways that tumors react to those therapies that cannot be interpreted just based on an MRI scan. And an MRI scan is the routine way that we measure tumor response to therapy. And we found that there are a lot of limitations to just routine MRI scans. So what we really need is a more advanced tool to really understand how tumors are responding to specific therapies. And in particular, immunotherapy is a really hot area of research right now and has a lot of potential to help patients with brain tumors. And so having a tool to measure how the tumor is responding to immunotherapy is really critical for us in advancing the role that immunotherapy has in managing patients with brain tumors. And even outside the concept of immunotherapy, even standard treatments can cause inflammation that mimic the appearance of active tumor. And the MRI just cannot distinguish between that inflammation and active tumor. So our goal with this PET tracer is that it identifies inflammation, so it'll identify the response to treatment, but it will not, the picture will be cold if there is active tumor, because tumors are very smart and they suppress inflammation. And so that way we'll be able to distinguish this really fundamental critical question: is there inflammation or is there active tumor? Since those would look exactly the same on a routine MRI scan. And so the trial at this point is working its way through our system for clinical trials. There are many steps that need to happen in order for a trial to open in real live patients. And so we're very close to reaching that open enrollment date. And so we anticipate it opening probably in the next 2 months or so. We would hope by the beginning of next year we'd have it open. One of them is really to lobby your congressman or congresswoman to increase the NIH budget. The NIH budget has dropped a fair amount in the last 10 years with the recession. And so without that funding, smaller cancers like brain cancers do not suffer from not having enough support from the NIH, which is really critical for doing some of the larger studies that we need in order to move drugs forward. And so making sure that the NIH is well funded is very important. So even just lobbying your congressman or congresswoman to improve that funding is critical. There are also national consortiums like the National Brain Tumor Association, which is another patient advocacy group, and they work with the NIH and with the FDA in order to advance the care of patients with brain cancer. And so networking with them, getting involved in what they're doing, and working with their efforts in order to advance push the NIH and the FDA to really focus on brain tumors is critical. One of the things that I've been participating with the National Brain Tumor Society is trying to standardize the way that we acquire imaging for all brain tumor patients. Ideally, it'd be throughout the country, but we have to start on a smaller scale and really been focusing on academic centers. And so if they have a broader reach in order to get these academic centers all together, and so if we can get this standardized imaging protocol for all patients who are getting treated for brain cancer, then we can get a lot more information about patients and how they respond to treatment. And the FDA is very interested in that because they want to have standardized tools in order to measure responses to drugs. And that gets the drug companies interested, because if they can have an early surrogate marker of efficacy, just an imaging marker, rather than waiting for a clinical endpoint like tumor progression or overall survival, then they are very interested in that as well. And then I guess lastly, one thing you could do is obviously just if you can petition drug companies, or if you know anybody who works with a drug company, just keep noodling them and saying, hey, look, this is an unmet need. These patients are in dire need of help. So you need to really focus on cancers like brain cancer, which they're a little bit less interested in because they're not as broad a population as something like breast cancer or lung cancer.